So, sir, could you throw some light on the topic how the diagnostic industry is behaving right now?
Look, as I told you, that diagnostic industry is not very new. Post-COVID, things have changed because a lot of non-players have entered into this industry, and it has a very, amazing future. Like every year, there is a exponential growth, and it is growing like anything every year. So lot of people, lot of corporate houses are coming in. You can see in recent days that now even this Amazon has also entered into it. Medanta has also entered into it. There
Yes,
are
sir.
plans that Tata 1mg has already entered. So it is divided into few segments. Like you see that Lal Path Lab, and there are few chain lab which has a chain of labs across India. But in spite of having such good number of labs across India, it does not constitute more than 20% or 25%, and including doctor labs and all this, the entire industry uh, working on the right track, maybe not more than 40%. So you can see that 60 or 65% of this industry is working in an unorganized sector. So we need to decrease, and they are our main they are main competitors or challenges, you say, because this market is also very price sensitive, because there are aggregators also who are ready to face because they are investor backed companies, so who are ready to face losses. They make their they cover up their losses from whatever means, I don't know, but they are ready to face losses only to create a buzz in the market. Okay, because they want to disrupt the market by any way. So when a genuine patient will come to you and you will charge the genuine MRP, they will say that, there is X lab or B lab or A lab, they are charging less than that, and you will be perplexed and you will be thinking like, how is it possible to give? Because I'm telling you that there are few labs who are offering tests on such throwaway prices that even if we calculate 10 rupees per test, it is not going to have it. Because nowadays what people are companies, there are few companies who are trying to manipulate our people like that, they are giving 200 tests for 500 rupees. They don't know that what these 200 tests will do. I mean, they are doing irrational tests and irrelevant tests. Okay, so in CBC they are adding, as you say, that CBC there are not more than 20 parameters which is actually relevant,
Yes, sir.
and doctors will understand and they will correlate with those parameters. But you say there are companies who are giving 35 parameters, those are research parameters, and they are fooling people. So these are the things which are real challenges right now, and the industry is behaving that way. So industry has nowadays become very price sensitive. Okay, last year you might have heard that the Delhi High Court has already given a cognizance to the Delhi government that in Delhi only there are 65,000 labs which are illegal labs running. You will see in front of AIIMS only, you will see n number of quacks, and you will see a number of people who will be franchising, taking the giving their lab cards or whatever it is, and they don't those labs doesn't exist. So these are big challenges which I think the entire industry is facing right now. The real people are not getting the place to work. The real people are not getting the things to franchise, because of those fake labs and fake people. The other people are getting the patients are getting discomfort, and they are getting misdiagnosed and wrongly diagnosed. So these are very big challenges which we need to face. I think on different platforms definitely people are raising this issue, but I don't know why government is so silent on such critical issues and such matter of national importance. So these are something which is disheartening at some point of time for single doctor owned labs, because when you are an investor backed lab, that you will be having a lot of money and you can play whatever games you like to play. But a doctor oriented lab really faces problems in fighting with those quacks and those unorganized or bad people. Thank you very much, Anshul. It was lovely talking to you, and I think definitely some little bit of insight I might have cleared with this small interaction, and I hope that people will not feel disheartened by joining lab medicine, because I would say that this is the best department. Because at one point of time, after some years, when you will put deep into this department, you are a lab physician. You can treat patients because you have the knowledge of both lab part plus the diagnostic part, and plus the this making a diagnosis part. We are the people who decides the different packages of the labs. So you invest your 6 years like anything, so that nobody can challenge you post 6 years, and you could be the master of your own. And what I say, good luck to the lab medicine. Thank you very much.
Thank you, sir, for your kind words. And